Hey you guys, it's Dr. G. In this video, I'm going to tell you how to fix your gut from a conventional standpoint, from an integrative standpoint, and from the biohacker standpoint. So let's get going. Woo! Get rid of the white coat. All right, so first let me talk about what I learned from my more than 20 years as a family doctor. If you go to the doctor's office, they're going to do a few things if you have tummy problems and tummy pain. What they're going to do, number one, is make sure you don't need to go to the emergency room. They might have you jump. And if you jump and your belly hurts when you jump, that's a sign that maybe a surgeon needs to talk to you. Or if they press down on your belly, especially in that lower right quadrant, press down on the belly and then let up quick and it hurts, that's called rebound tenderness. And that might mean you have appendicitis. Okay, so those things need to be managed in the emergency room. And that's the first thing a doctor will do. Make sure you do not have a surgical abdomen, because we don't want those surgeons cutting into us if we can help it, right? The next thing that they would do is they may order some labs and ask you about your history. Like, when does it hurt? Where does it hurt? How does it feel? They're trying to determine whether or not this is coming from heartburn, from your stomach, from your gallbladder, or from your intestines, or from your pancreas. They're trying to figure out what area this might be caused by. Once they've determined that you don't need to go to the emergency room, they're going to start to think about things like infections, blockages. Could you have reflux or heartburn? So they're going to go down a list of things such as gastroesophageal reflux, seeing if you're having, and ask you questions to try and determine which is going on so that they can give you something that will help with the symptoms. All right. So if you do not have heartburn or ulcers or gallbladder problems or celiac disease or inflammatory bowel disease, if they've done their CBC, the blood count, and maybe even done a poop test, sometimes you'll get that, at which point they would say you have IBS, irritable bowel syndrome, and you would be given a low FODMAP diet. All right, so if you're feeling generally okay with just some tummy troubles, it's reasonable to try a low FODMAP diet. If they think maybe you have reflux, they might give you a proton pump inhibitor. They might give you something like Zantac that will decrease acid secretions, hoping to reduce the heartburn. So these are things that you can get over the counter. However, you don't want to take them for a long time because acid blocking medications can also interfere with nutrient absorption. If you have a gallbladder issue, they may send you to go get some imaging studies. So to see if your gallbladder is blocked. And what does that lead to? If your gallbladder is blocked up and you're having abdominal pain, well, that leads to them saying, don't eat fat and go and have your gallbladder out, which it seems drastic to me. If you have maybe a tummy infection, they may check a stool test. Sometimes they'll do that to see if you have a tummy infection, and that would lead to getting antibiotics, right? So they're trying to figure out what is the source of this. And if you stay till the end, I'm going to give you a handout that will tell you just what you should do to try and get your gut feeling better. Maybe you can DIY this. Maybe you can do this without a doctor's help. Wouldn't that be great? Yeah, because I know you're the kind of person who doesn't have time to waste going to the doctor, right? So stick to the end so you can get that link. Now, when you go to an integrative provider, they're also going to do all those things, but then they're thinking in the back of their mind, well, what's the root cause of this? All right. And in general, when we're thinking about the digestive tract, what makes it hurt and uncomfortable, it's kind of a short list of things. All right. The first thing is sometimes foods can create problems. And the only way to truly find out if you have a problem with foods is to do something called an elimination diet. And that is the first place that most functional medicine, integrative, holistic providers will start to try an elimination diet. It's not very hard. It's not forever. You can do it. And I'm going to give you the tools to be able to do this if you stick to the end of the video. So an elimination diet will take out the foods that commonly will cause some degree of response. Commonly, we'll take out gluten and dairy, a few other things, but I'm going to give you all of that in the handout at the end of the video. Okay, so this is a really reasonable thing to try. There's no side effects. You only have the risk of feeling good, right? So the other thing that an integrative health doctor would do would be seeing if you have enough enzymes and stomach acid. So many times, I have to admit, as a family doctor, people would come in and say, oh, my stomach hurts a little bit after I eat. And I would give them something that blocked acid. I know, right? I totally did that. And I say, let's just try this for a little while and see if it helps. Well, in my ignorance, I didn't understand that I may have been actually hurting them and giving people acid blocking drugs who didn't have enough acid. So we do a kind of check to see if someone has enough stomach acid. That's easy to do at home. It's called a BETAINE HCl challenge. BETAINE HCl challenge. You can do this at home, right? Take this into your own hands. The other thing that an integrative provider, a functional medicine doctor, holistic doctor, naturopath might suggest is bitters. Bitters before meals and enzymes with meals. These are simple, inexpensive ways that you can often really help your health. Let's say the functional medicine doctor is trying to consider what is the root cause of your stomach pain. Well, we've dealt with digestion, right? So making sure you have enough of the enzymes and all that triggers digestion. The next thing is your microbiome off balance? So they may order a stool test and look at your microbiome to see who lives in there and see how they might be able to tweak it. Most functional providers are going to say using fermented foods can be very helpful. But if you have irritable bowel syndrome and you've gone to your doctor and they've diagnosed you with irritable bowel syndrome, first thing that we'll do is take out fermented foods because they are part of a higher FODMAP diet. So eating a low FODMAP diet can be helpful. The next thing with gut issues is hidden infections that are not obvious can create problems. So overgrowth and infections, even infections that are throughout the body. And those are also something that your primary care provider may not know to look for, that your functional medicine doctor will look for. And lastly, any holistic provider is going to really focus on stress because your digestion is dependent on you being able to step into that rest and digest kind of framework. In our nervous system, we have that go, 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 which is the sympathetic system. And we have the let's just chill. Let's chill and let's digest. And that's where you have to go in order to get good digestion. So one thing I'm going to suggest to you is that number one, around mealtime, no politics allowed, everybody, okay? No, it doesn't matter what side you're on, no politics at the dinner table because it gets people riled up. They get into that sympathetic go, go, go state. Let's calm it down. We're only talking about positive things. We're enjoying our family. We're chewing our food. Chewing is a very important part of digestion and really trying to take some nice slow breaths while we're breathing to encourage our gut to digest well. All right. So really important. Make sure you stay to the end because I'm going to be giving you some wonderful handouts about how you can reset your gut and make it feel better. But we get to the most important part. What does the biohacker do to get their gut better? All right. So this is when I say it's all about adding energy. And I believe that this is the next phase of medicine. In 20 years, all doctors will do this, but let's just go ahead and jump to the chase now. There are ways that you can apply tiny bits of current and light to your body in order to get an awesome result. One of these ways is frequency-specific microcurrent. Frequency-specific microcurrent can give current that talks to the cells. We also see people using magnetic fields to improve blood flow to different vascular beds. So better blood flow and resetting the cells using current and light can make a huge difference in how your body behaves. It can bring wonderful healing. And so this is the next phase of medicine. And I'm excited for you. Make sure you get your copies of the elimination diet and these tools that I have for you so you can reset your gut on your own. You don't need to go to no stinking doctor, right? And I'll see you in the next video where I'm going to talk about how to heal up injuries, right? All right, see you there. Bye.